At first, when he started to snore, I was really just annoyed more than anything. I would push him or hit him with a pillow to try to get him to stop. But then gradually it got worse, and there was times when it was so bad that I was afraid that he wasn't even breathing at all. I got really worried about him, and I wanted him to get it checked out.
I really wasn't concerned about the snoring at first. I mean, it's a genetic thing. My dad snored and my mom complained a lot about it too. But then a funny thing happened. I went into my dentist office and they gave me a questionnaire, and it was one of those like, check yes if this applies to you. And I found myself saying yes to almost everything. And at the end of the questionnaire it says, if you are experiencing 3 or more of these symptoms, you may have sleep apnea. And I was like, I got a perfect score. Like, do I get some kind of prize? Of course I wanted to find out what was going on, so I agreed to do the sleep study. I took a machine home that measured my heart and oxygen levels as I slept.
Sleep apnea occurs when a patient is sleeping and can't get enough oxygen into his or her system because of a blocked or obstructed airway. Even when awake, patients with sleep apnea tend to push their neck forward, opening their airways to allow more oxygen into their system.
It wasn't really shocking when the test came back and said he had a sleeping disorder. It was actually good news because knowing is the first step in being able to do something about it.
Statistically, more than 60% of patients who are diagnosed with sleep apnea and are prescribed a CPAP do not wear it because of discomfort. A dental appliance is an effective treatment option for most people and is much easier to use.
I didn't realize that I wasn't getting good restful sleep because of my sleep apnea. But now I get a really good, comfortable night's sleep and I feel great during the day.
And I know I sleep a lot better. No more snoring, and I'm not worried about him all the time. I'm just really happy that we're past it.
Sleep apnea is one of those medical conditions that a lot of people don't know that they even have. And why it's really important is that sleep apnea can lead to other medical problems like high blood pressure, diabetes, cardiovascular disease. The 2 of the big indicators for sleep apnea are daytime sleepiness and snoring. If you have any of those 2, you really should get evaluated for sleep apnea.
Finally, rest quietly, wake feeling revitalized, and give yourself a chance to avoid some of the complications that come with leaving sleep apnea untreated. We look forward to having the opportunity to serve you. Be sure to let us know right away if you're experiencing any of the symptoms of sleep apnea. Please take advantage of our new patient special by calling today and mentioning the offer below.